COVID-19 pandemic, as we know, is leading to some of the deadliest days in U.S.'s history.
And here in Rhode Island, more than 1,500 people battling the virus have now died. That grim milestone comes, though, as the U.S. is just one step away from a coronavirus vaccine. The FDA could provide emergency authorization at any moment after an advisory panel concluded the Pfizer vaccine is safe and effective.
Now, once the FDA gives that final approval, Rhode Island says doses could be here within days. And new at 4, we're learning how the vaccine is getting here and where it's going first. 12 News reporter Brandon Truitt is live at Rhode Island Hospital, and Brandon, employees there started scheduling vaccine appointments just today.
Yeah, Kim, one doctor put it this way: it's the happiest he's ever been to hit send. That would be on his application for his appointment. The state tells me that when the vaccines start coming in, they're going to go straight to the hospitals. You get a sense tonight that things are starting to develop rather quickly.
I'm excited. I'm very excited.
In the world of public health, this is as big as it gets.
We're focusing on everything.
Dr. Carrie LaPlante with URI's College of Pharmacy also serves on the state's Vaccine Advisory Committee. She says they have been planning for this moment since October. The vaccine not skipping any steps.
This vaccine has gone through the traditional phase 3 clinical trials. It's going through the same federal regulatory authorities for final review of the safety data. They have the independent group investigating and monitoring all activity, all side effects.
All that to say it's being vetted before it gets to you.
We have all of our supply lines and chains and logistics ready to go.
The Department of Health says vaccines will roll in on FedEx and UPS trucks, taken straight to hospitals throughout the state. Doctors at Rhode Island Hospital gleefully tweeting their appointments have already been made. I cannot wait to be protected from this horrible virus, reads one. But in the meantime, mask up, please.
We're simply waiting to get the vaccine, and when we do, we'll be ready to start.
The state says hospitals already have the equipment to keep the vaccine at the necessary 94 degrees below zero. Pharmacies are working to get it too. Tonight, a sense of relief is not a matter of if, but when, with doctors feeling duty-bound to receive it.
I'm happy to be the first one to receive this vaccine as a healthcare professional.
So hospitals are going to be administering it to their own staffs. Pharmacies will be taking this to long-term care facilities. Guys, that will get us at least through the first part of phase 1.
And Brandon, of course, a lot of questions right now. A lot of folks are asking tonight how this will work for them. So what is the Department of Health telling you about the later phases?
Yeah, listen here. The state says they're still trying to iron out some of what the rest of these phases are going to look like. They do say that they're going to do, quote, broad communication to the public as to inform you when it's your time to go. From that point, once you're notified, whether it be through a television announcement or us here at 12 News conveying the messages from the Department of Health, that is when you're going to know it's your turn. You'll get to choose what pharmacy or doctor's office you go to.
All right, Brandon Truitt, thanks so much.